Okay, Assalamualaikum warahmatullahi wabarakatuh. My name is Aisha Minta Azudin from Hayat 1. So today I will be discuss about the metabolic syndrome for the assignment biology 1 question number 1. Okay. Next, so we will be discuss about four things, which is the definition of the metabolic syndrome, the risk factor, the progression, and also types of diet that we can do to manage the metabolic syndrome. So for the first part is the definition. Okay. So what is metabolic syndrome? So metabolic syndrome is a cluster of symptoms called risk factors that will increase the risk of having more serious health problems such as heart disease and type 2 diabetes if three or more of these symptoms or risk factors are possessed by the patient. Okay, so the risk factor of the metabolic syndrome, there are 5 risk factors. So we'll go one by one. Okay, so first is the high blood glucose. So high blood glucose is caused by the low level of insulin. We all know that the function of the insulin is to convert the excess glucose to glycogen. So insulin is produced by beta cells. So low level of if beta cells cannot produce enough insulin, so it will lead to type 2 diabetes. Okay. So next is the low level of HDL. HDL is the high density lipoprotein or known as the good cholesterol. So HDL function is to absorb LDL. LDL is the low density lipoprotein or known as the bad cholesterol. So if there is low level of HDL, so LDL cannot be carried to the liver. So LDL will be accumulated at the wall of arteries. Okay, next is the high level of triglyceride. So high level of triglyceride means that of the combination of high level of LDL and also low level of HDL. So by that, LDL will be accumulated at the wall of the artery, making the size of the lumen small, so it will be harder for our blood to flow to the body, so less oxygen will receive by the body cells. So next is the large waist circumference. So large waist circumference can be seen by the apple-shaped body type in the diagram. So the large waist circumference also one of the indicators of the abdominal obesity. Abdominal obesity means that the fat surrounding the liver and also other abdominal organs is very metabolically active. Okay. So lastly is the high blood pressure. So high blood pressure is caused when the fats deposited in the wall of arteries. So it will make the size of lumen smaller. So more force needed to push the blood through. So the higher the force, so the higher the blood pressure. Okay, so part 3 is the progression. What I meant by the progression is that what metabolic syndrome can lead. So what disease can metabolic syndrome lead to? Okay, so there are 3 types of disease. So firstly is the type 2 diabetes. So type 2 diabetes is the disability of the body to regulate and use glucose. So there are 2 factors contribute to it. Is that first, the pancreas cannot produce enough insulin. Second, if the cells respond poorly to the insulin and will take in less glucose. So because of these 2 factors, it will result in excess glucose circulating in the bloodstream. So second is heart disease. So there are many types of heart disease. For example, coronary artery disease called CAD. So CAD can affect the blood flow to the heart, but if it's severe, it may lead to heart attack if the coronary artery is fully blocked by the fats deposited. Okay. So lastly is the stroke. Stroke is caused when the blood flow to the brain is disrupted by clot as it blocks the blood vessels. So the patient may experience paralysis either at their face, arms, or legs. So last part is the types of diet that the patient can do to manage their metabolic syndrome. So first is that the patient can do rich fiber diet. So the fiber can lower the level of LDL. So example of food that has rich fiber is oatmeal, wheat, fruits, and also vegetable. So second diet is rich omega-3 fatty acids diet. So omega-3 fatty acid can help to increase the level of HDL in the blood. So the HDL can absorb more LDL. So example of the omega-3 fatty acids food is sardine, mackerel, salmon, almond oil, and also olive oil. So in conclusion, the metabolic syndrome can be avoided if we do healthy lifestyle and also exercise. Okay, that is all from me, Aisha binti Azuddin. Thank you.